Good evening, everyone, and welcome. We're glad that you've chosen to join us tonight. Catholic Forum is a series of talks on issues that are of interest to us as Catholics from a social and a theological perspective. The Catholic Forum is sponsored by the Mysteria Lucis Lay Dominican Fraternity, the Priory of St. Mary's, and the parish here. So thank you for coming and choosing to spend the evening with us, looking at our topic of medical, spiritual, and psychological aspects of depression. So as we get started, I would like to introduce our speaker to you. Dr. Paul Ungar earned his MD in 1966. He specialized in neuropsychiatry in 1974, completed his MS degree in 1976, and then he studied with Dr. Viktor Frankl in Vienna and completed his PhD in 1979 at the University of Belgrade. Finally, between 1985 and 1990, he studied theology at the University of Zagreb, earning a graduate degree in theology. So as you can see, he's quite accomplished. After immigrating to Canada in 1991, he became a registered psychologist in British Columbia, taught at Trinity Western University, and has been in private practice since 1998. In addition to all of that, he has published 1 book in Croatian, 1 book in German, and 3 books in the English language. He has been married since 1971 with his wife Marta. They have 7 children and 17 grandchildren. So please join me in welcoming our speaker, Dr. Paul Ungar.
Thank you for this nice introduction. I wrote it, but it was nice to hear. Let me start my presentation 60 years or 50 years ago, half a century ago. At that time, I got my medical degrees and I started my residency training. And one of my first patients was a young man who attempted suicide. He was 26, 27 years old, and he was brought to the hospital unconscious. And the older physician told, "We cannot save him, he will die." But I, as a young physician, wanted to prove myself and to demonstrate that I learned some medicine. And when we tried this and that and so, after 1 or 2 hours, he opened his eyes. And now I expected a great thank you. He will say, "Thank you for saving my life," and so on. But no, he opened his eyes, looked at me, and he told, "Why did you save me? Why must I live?" Poof. What should I say to this? Why must you live? I told something, the older physician looked at me, I should respond. Well, I told something trivial, that nice girls are waiting for you or something like that. Anyway, he was admitted to the psychiatry. He was there for 3 or 4 days or even longer. And then he signed that he will not attempt suicide again. He was discharged. He was not psychotic, not even significantly depressed. They discharged him. After a week, he did it again, and this time he succeeded, and he died. And I was then tormented with the question, what should I have said to him? What I felt I had the opportunity to save him, but I didn't know how. Yes, I finished the medical education. Yes, we learned how to save lives. But what is the purpose of life, and what should I say to this man, why must you live? We didn't learn any answer. And I started thinking about this, what should I have said to him? And I realized nothing in medicine, nothing in psychology, nothing in philosophy, nothing in mathematics, Nothing in chemistry or any science gives the answer to this, but only religion. So spirituality, the finding the reason why to live for, discerning a purpose to live for, is substantial. It is essential to every human being. And then started my interest in this area. Now, yes, he was depressed. Yes, he was suicidal. But what made his depression? There are at least three kinds of depression. One is caused by endogenous reasons. When my brain is sick, it is not producing enough biochemical mediators, and then I am depressed. This is one kind of depression, which is caused bipolar depression or major depression, if it is depression. So bipolar disorders are manic and depressed, and sometimes they oscillate between mania and depression. This is the first type of depression. The second type of depression, am I not talking enough, noisy enough? Because I can, okay. So the second type of depression is reactive depression, when I'm reacting to sad situations or sad news or a disaster. For example, if I would get a telephone call now that stopped the presentation because your family had a traffic accident, then I would be depressed. And my depression would last, let's say, 6 months. And after 6 or 8 months, I would recover and I would find another purpose, another reason to continue living and fighting, and my depression would be resolved. So this is the reactive depression. The third type of depression would be this, which lasts 10 years, 15 years, which starts in age between 10 and 20, or let's say 15 and 20, and it continues eternally. This is called persistent depression, or it was previously called dysthymia. Okay, the word dysthymia, thymion in Greeks means mood. Dysthymia means a disturbed mood. So this kind of depression is a permanent, long-lasting depression, which consists of a feeling of a gap between this how I am and what I ought to be. And I cannot bridge this gap. I have a permanent feeling I am not good enough. Whatever I am doing, it is not good enough. It is a long-lasting, permanently recurring depression with little symptoms. So many of us have it. It is almost a form of human being. It is not a heavy depression. It is not a clinical depression. People work with this, people live with it, but it is also a kind of depression. So those are the three kinds of depression. As you can assume from my presentation, the first is caused by problems in my brain. The brain is not producing enough biochemical mediators, and this is then evident in my behavior with symptoms of depression. The second kind of depression, the reactive depression, is caused by psychological reasons. I lost my family and I am reacting to it. And the third type of depression is caused, well, it is too exaggerated to say caused, but it has spirituality an important momentum in it. I am not saying that every depression is caused by spiritual reasons. But no depression is healed appropriately without resolving also the spiritual problems. Let me say this one more time, underline it. So not every depression is caused by spiritual problems. But no depression is appropriately treated without resolving the spiritual problems in it. So then, what causes the depressions? Somatic reasons, psychological reasons, and spiritual reasons. Okay, that we have a body, that we have a brain, and it makes the depression I have not to demonstrate. This is evident. We can see, touch, and measure. But what is the mind? What is the psychological reason of depression? What is the psyche? Is it a product of the brain? And is my psyche only this, what my brain produces? Or is it something spiritual? Or is it something between the body, what my brain produces, and my spirit? Or what is reality, what is my mind? What I think or feel or will or remember. Okay, so what is the mind? There are many and different understandings, and we can discuss it later on. It is not an issue connected to depression, but to anthropology. And if you have questions, we can later discuss. But in summary, I will say that as one chicken produces the other chicken through the egg, so one thought in my mind produces the other thought through my brain. Let me repeat this. As one thought produces the other thought by regulating my brain, so one chicken produces the other chicken through an egg. Okay? I don't know whether I was clear enough. Should I talk more about this or not? But if you have later on questions, I will be happy to discuss this in details, in small details. Okay, now the spiritual component. Do we have a spirit? What is the spirit? How do we know that we really have a spirit? Yes, the Bible says it. Yes, we believe it. But is it something what we can empirically understand? Has it a real, I'm not saying visible, touchable, and measurable, but is it really something what is evident in human behavior or not? Let me illustrate this with an example, what the spirit would be in an empirical perspective. Let me say so. If I drop this, it will fall. This is a causal effect. If I drop it, it will fall. If I'm working, I'm getting money, I'm getting paid. It is a causal relationship between my work and my payment. Now, everything in the universe is regulated by causal principles. The motor of your automobile works in the same way causally as everything else in the universe. There is no exemption from this. Everything in the universe is regulated causally. Everything on the earth is regulated causally. You can find nothing in the earth what is not happening by the cause and effect principles. Everything in plants is happening causally. Everything in animals is happening causally, regulated. Everything in my body is regulated causally. My heart rate, my breathing and whatever, everything is regulated by cause and effects. There is only one exemption. This is mind reasoning. This is my mind. This is the only place in the whole universe build a more known universe which is not regulated causally. I plan today to come here, and you planned today to come here. You didn't come because of a cause, but because of a goal. No human behavior can be understood without understanding the goals people strive for. Okay? So we are not causally regulated, but goal-oriented. We have a purpose. We find meanings. We find values, and so on and so on. So this is the difference between everything else existing in the universe and people and humans. Okay? Now, you came here, you planned your coming today here. Will you make money with this? No. Will it serve you to survive? No. You came here because you were called to come here, because the Spirit called you to grow, to learn something, to transcend. I don't know what are you watching there.
Sorry, I probably changed the slide too early.
Okay.
Yeah.
Because I see that you are looking there.
Yeah.
Okay. Excuse me?
You put the volume up just a touch.
So I'm not noisy enough. Is it now better? Oh, I'm sorry for this. No. If I'm not clear, if you cannot hear me or you have any difficulties, please tell me. Okay? Raise your hand. Okay? So then let me talk in the microphone. So the only and the significant difference between everything else and human is that we are planning our behavior, and this is not a causal effect, not a causal process, but a goal-oriented spiritual process. And you planned here to come today, and you will not make money with this, and it will not help you to get rich or safe and secure, but you are seeking a spiritual purpose to learn something, to grow, to transcend. Now, this is the spiritual essence in humans. This is what makes the difference between everything else, between animals and humans and plants and humans and so on. Now, on this spiritual component will be focused also on understanding and treatment of depressions. But let me now finally focus on depressions. Could you give me please the second slide, the second projection?
The one with the brain and the cell?
The second one. A lady who is depressed. On this picture you see a depressed lady. She has a major depression. What can you see on the picture? Look at the room. The room is not quite cleansy and not quite organized. Everything around her is to some degree neglected. She has no energy, she has no will, she has no motivation to take care about her environment. She cannot take care even about herself. Her hair is not groomed in the best way. Her skin is dry. She has wrinkles. Her clothing is not quite maintained either. Why? Because she has no motivation to clean and to organize everything around her. She has no motives, she has no energy. She looks somewhere in the nowhere. She is sinking in her thoughts, in her feelings, and it is almost impossible to bring her out from her self-reflection, from her feeling, I am helpless, I am hopeless, I am depressed. Okay? Now, if you start communicating with her, how will the communication go on? You can ask questions. Will she respond or not? No, she will probably not respond. If she responds, she will respond in very short sentences and then stop talking. The only thing what she would talk about is her suffering, because she is obsessed with pain. She is obsessed with suffering. She is living, as one of you told before this session, like in a hell. And she can talk about the hell in a low voice, slowly looking down to the earth and then stopping talking. This is how depressed people talk. First they look at your face and they talk then slow, in a low voice, look down and they stop talking. Okay? What else can you see? She is moving, she is sitting almost like a sculpture. She is not moving. I am permanently moving. And all of us are permanently, this is called psychomotoric. So my psychological experiences are expressed in my motoric, in my movements. Okay? She is like a sculpture. She has no psychomotoric movements. Okay? So this is what you can get from talking to her. What shall we talk about? She will talk about her depression. Her thought process is compromised, in a sense that she will talk less, and the content of her thoughts will be always depressive, always sad, always talking about unpleasant pain and suffering and disappointments. How will her feelings be? They will be polarized towards sadness. What the word sadness means? It means the experience of helplessness, hopelessness, being lost, being unworthy. She will produce a lot of irrational guilt feelings. She will say, I'm guilty for everything. That means I'm guilty for the war in Ukraine now. I'm guilty for the World War I. I'm guilty for the American Civil War. I'm guilty for everything. I'm so unworthy that even breathing has no purpose for me. I'm only spoiling the world. So this extreme guilt feeling, irrational guilt feeling, is one of the main signs of depression. How will her remembering, how will her memory be? It will be well contained. However, she will talk only about sad things. Everything was bad in my life. My early childhood was spoiled with violence and suffering and pain and whatever. So everything in her recollections, in her memories is terrible. It was a suffering. How will her will be? She has no will. She has no motivation to do anything. She has no energy. She has no power. How is her attention? Well, our attention is fluctuating. It is called vigility. I can shift my attention here and there. This is called vigility. Excuse me. Her attention has no vigility. She cannot shift her attention on other things, but only on depression. So the tenacity of her attention, that she is permanently focused on one thing, is highly increased. A significant sign of depression is what? Guilt feeling and suicidal behavior. But before we talk about that, let me talk in a few words about sadness. We all are sometimes sad. There is no human who has no bad experiences or periods when he or she is sad. For example, bereavement is a typical situation when people are sad. But it is a big difference between bereavement and depression. Not every sadness means depression. There is a big difference between the two ideas. In bereavement, people are socializing. They are talking about their loss. They are planning their future. They are active. In depression, they are isolating themselves. They have no plans or no goals for the future. They give up their life. They are interested in nothing. Okay? This is the difference between bereavement and depression. Now, let me talk about the other alarming sign of depression. In depression, that is suicide. We all have a strong motive and a strong drive to preserve life. So what makes people to kill themselves, to give up their lives? What is the explanation? What happens in people when they feel, I have to give up my life? What is the suicidal psychology motivated by? It is a mystery. But let me try to analyze it this way. Well, I will say a stupid example, so don't take it literally what I am saying. I will try to illustrate it. If this young gentleman would come and give me a big slap, what should I do then? I return the slap, everything is okay between us. Then we are leveled up. However, I cannot slap him in front of you. I will never get any entrance in this church anymore. People will expel me from coming here, okay? So I have to endure it. And he comes tomorrow and he slaps me again. Again, I cannot retaliate. I have to endure it. And he comes the next time and he slaps me again. Again, I cannot retaliate. I have to endure it. And then when he comes the fifth time, then I would feel first fear. Then I would feel anger. Then I would start to hate him. And then I would feel a helpless rage. Now this helpless rage is the most destructive human feelings. We can endure many things, but not the helpless rage. This is the most destructive human feeling. And when I feel the helpless rage, then I would tell him, you know what, you can come, you can slap me one more time, but then I will kill myself, and you will be guilty for this, and you will be never able to forgive yourself. The longer you are alive, you will suffer from guilt feelings. Now, this is the suicidal psychology. Indeed, the slapping was a metaphor. It means in sickness which is inhalable. It means losing job. It means losing a partner. It means disappointment in love. It means many, 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 many things. In the case of depression, it means sadness, what I cannot get rid of. And it makes me to feel this helpless rage, which I cannot endure. I have to explode. But people implode when they start thinking and start considering suicide. How can you prevent suicide? How can you realize that the person is thinking about suicide? Indeed, sadness is one critical point. The other thing is, people usually reveal their helpless rage. They blow up. They are becoming aggressive, verbally, or even physically they act out. However, they calm down. When they decide I will kill myself, then they calm down. This is called pre-suicidal syndrome. In pre-suicidal syndrome, people are calm. I made my choice. I know I will kill myself. There is no problem for me anymore. I will kill myself and I'm clear with my life. It is important to catch this pre-suicidal syndrome in depression. When depressed people start talking about suicide, when they start feeling as if settled with their life, this is the dangerous situation then. They make sometimes allusions and sometimes they make you to guess and they make you to think or feel, for example, to say, I will never more come and to need this pulpit, okay? But this is then the sign that the person is considering suicide. It is important to catch this period. The most important thing in preventing suicide is what? Warmth, personal communication, not coolness, not even justice, but personal communication, personal warmth, making the person to feel I am concerned about you. There was a German writer, Franz Werfel, and he wrote a novel which is called Last Leaf. And the novel goes something like that one lady was suffering of a serious depression. She was healed in the hospital for a month. It became summer, it became fall. And slowly the leaves from the trees were falling down. And then she told that when the last leaf falls down from a tree, then I will die. So the leaves were falling, 10, 9, 8, 7, 6, 5. At the end, it was only one leaf on the tree. And she was expecting the next day whether the last leaf will fall off or not. She awoke early in the morning, but the leaf was there. The leaf didn't fall. The leaf didn't fall the next day, the next week, until the spring. In the spring, she was discharged as a healthy person. The depression is gone. When she was discharged, then the nurse told her that her physician put a leaf from paper on the tree to prove her that the last leaf didn't fall down. And the lady told her, oh yes, I knew this. I knew that the leaf is artificial, that you put the leaf on the tree, but then I realized that I'm so important to you that you put the leaf on the tree, and then I decided not to kill myself. So this is what personal relationships means to a depressed person. The difficult question all depressed people are suffering from is this: am I guilty or not? Can my relationship with God resolve my guilt or not? Well, can it dissolve? Can your religious conviction resolve your depression? No, it cannot. It can very seldom help. But if my brain is sick, then almost nothing can resolve my problems. It is a classical example of a nun who, her name was Michaela, it is a pseudonym, and she has a terrible guilt feeling that she cannot overcome her depression with her faith. that God is not helping her, that she is probably guilty because she's not relying on God, and so on and so on. And then Frankl, he was my teacher, explained her that no, your brain is sick, and now God is asking from you patience and hope and optimism and courage to fight your depression, and not to expect that you will be healed by your faith. So sometimes God is helping by giving patience and courage and hope and optimism, and not by healing like that. Okay? Well, in medicine nothing works according to rules. I personally had a priest whom I will never forget. He was an Orthodox priest who got a depression. And his depression was very deep and lasted for 3 or 4 months. However, he learned, somewhere he read, that God is closest to people then when they are most miserable. So he started to pray, not to get healthy, but to get even more miserable, to be more close to God. As he was praying not to be healthy, but to be depressed, the depression is gone. So this is what I experienced. It is, now I will talk about the reactive depression. It is a known story that, Girolamo Savonarola, he was a very prominent and very committed, but a bit fanatic priest some 500 years ago in the 16th century. He was once walking on the street and he saw a painting in one window of the Virgin standing by the cross and crying. And he got very angry and immediately went to the actor, to the painter, and told, immediately take out this picture and change it. Yes, the Virgin was standing below the cross, but she was not crying, but on the contrary, she was happy that she could serve the salvation of humanity. Now, I don't know, maybe Savonarola, he was, I'm telling you, he was a bit fanatic and very, to some degree, and sometimes very emotional Dominican priest. Now I have to tell you this. I don't know whether his flock could follow him, whether really we could pray, or Virgin Mary could pray below the cross and be happy that I helped the salvation of humanity. Yes, sickness is sickness, and sin is sin, and they are different things. Depression is not connected to sin. There is nothing sinful in depression. It is a simple disorder, a sickness. While sin is intentional, transgressing God's commands, which has nothing to do with sickness. It is a free and deliberate choice, while depression is never a free and deliberate choice. Okay, now let me get the third projection. Let me first say what not to do in depression, and then we will talk about the healing of depression. In depression, never set commands to the patient. Come on, have joy, enjoy yourself. Let's go, let's have a drink or whatever. No, the depressed person cannot do this. They would do this if they could, but they are unable to do this. They cannot be happy. So never force a depressed person or try to convince, be happy and enjoy life and so on and so on. Secondly, never increase the guilt feeling of a depressed person. That would be a serious mistake, because depressed people already have depression, and increasing their guilt feelings is a serious mistake. But let me talk about the healing of depression. And I will take this. Can you hear me now? Can you hear me now? Uh-huh. Can you hear me? No. Is it working now? Okay then. Then I will come here. Here you can see how the psyche works in psychoanalytic perspective. This is Sigmund Freud's model. How a human personality is constructed, how it works. Everything what is below the water surface is the instinct. The instinct is born in, it is given. Every one of us has the same instinct. There is no difference. The instinct serves survival. So I have the instinct to eat and drink, to sleep, and indeed the sexual instinct belongs there. It is born in. The instincts help me to survive. And I'm listening my instinct mostly. When I'm hungry, then I'm eating. When I'm thirsty, I'm drinking. And I'm resting, and so on and so on. However, in a civilized society, if I would always do what my instincts are demanding from me, then first I would steal this nice machine what he has here, because I would like to have one like that. But if I would do this, he would complain to the police, I would be arrested. So I have to control my instincts. The instincts are becoming an enemy to my socialized behavior. Okay? They are becoming dangerous. So then, a big part of the instincts takes a counter-instinctive role and starts to break down the instinct with the same power as the instinct would like to dominate my behavior. This is above the water surface, and this is what Sigmund Freud called superego. Okay? So there is a clash between the instincts, which would like to dominate my behavior, and the superego, which would like to control my behavior. And where is my personality? My personality is this thin waterline pressed between the instinct and the superego. It is pressed between the two superpowers, but it has a big role. It can either comply to the instinct and do what the instinct is demanding, or to the superego, the allegedly conscience. Okay? So I have permanently to make a choice. Will I comply to my instinct, or will I comply to my conscience and superego? This is Freud's model. In depression, the superego becomes pathological. It is overwhelming. It is absolutely controlling the self, the personality. It is merciless. It is abusive. It is pathological. It makes me to feel guilt when I'm not guilty. It makes me to feel that I'm miserable, that I'm worthless, that I'm hopeless, that I'm useless, that I'm nothing. Okay? Is this a Christian conscience? No. Ladies and gentlemen, can you give the next slide? The Christian conscience is quite different. The Christian conscience is loving, like Jesus. It is forgiving. It is understanding. So I plan to analyze this with you. So the superego serves worldly survival. The Christian conscience serves holiness, being set apart from the world. Okay? The superego promotes biological life. The Christian conscience serves everlasting life. Those are big differences. One's position in the society shapes superego, while Jesus' teaching and the Holy Spirit shape Christian conscience. The superego is an internal inhibitor, while the Christian conscience is an internal stimulator of discipleship. So there are very big differences between the worldly superego and the Christian conscience. And in my understanding, a big part of the treatment, of the pastoral treatment of depression is focused on helping the people, the patient, to get rid of the pressure of their superego like conscience and to adhere to Christian conscience, which is, as I told, very different. So don't be enslaved by your superego. Try to trust your Christian conscience, which is not an internal policeman like the superego, but it is loving and forgiving and easygoing. If you give the other slide, here are the, maybe I should print it out and I give it to everyone, okay? Here are the other differences between the strict and unforgiving and policeman-like superego and the real Christian conscience. I would like only to draw your attention on the difference between the two. Depression is always corrected to a strict and unforgiving policeman-like conscience. It is your enemy then. Switch from this policeman-like conscience to a Christian-like conscience. This is the essential task of every treatment. Okay, at the end, let me go back. At the end, now we will make a break for 5 minutes or 10 minutes, and then you can ask questions. I will be happy to discuss with you. However, I would like to introduce the purpose of this presentation which you attended. And the purpose would be to announce the opening of a Dominican counseling center. So the idea is this, that a Dominican counseling center there would work a professional psychologist, that would be I in this case, would treat parishioners, not only of the St. Mary's parish, but of all parishes, in helping them to overcome the Freudian and strict and policeman-like conscience and to replace it with a Christian conscience in case of depression. The idea is that people who have insurance, they would pay $250 if they have insurance. People who have no insurance would pay so much, how much they are really comfortable to pay. If it is $1, $1. If it is more, very good. People who cannot pay anything would get treatment free of charge, completely. This is the idea. So not money is the most important thing in this treatment. The idea is this, that you would refer, not you, but people who are in need for this, would refer to the secretary. She would make the appointment, and we would have an office which is shaping now and building now, and probably in few months it will be completed. But until that time, the office is completed. My office in Surrey would be open for this Dominican Counseling Center. We would treat all disorders diagnosable according to the DSM-5. Do you know what is the DSM-5? It is the statistical manual of the Psychiatric Association, talking about what is sickness and what is not, except we would not treat gender problems, gender dysphoria, alcoholism, and drugs. But the other DSM-5 disorders, we would treat them in a Christian perspective. Now, this is the idea I wanted to introduce today, and that was the purpose of this presentation. Now, let's take a break for 5 or 10 minutes, and then I will be happy to answer your questions. And thank you for attention. Thank you.
Hi, Doctor. Did you say, did I hear correctly that you're going to have an office here in a couple of months? Yes. And will it be specifically geared towards depression and anxiety? Oh, good. Okay.
Community in Vancouver, we're contributing to this project and offering for an afternoon of the week, we will offer a location where it will be possible for Dr. Paul here in Vancouver to meet with people. But there's still a lot of work to be done, and I cannot promise a date at this time of achievement.
But he said it was going to be being built here. I thought that's what he said in his speech.
Not in the church.
In this little area.
Yeah, we're about 10-minute walk from the church. So it's not far from the train station, but it's not in this church, it's not in this building.
I'm curious about imposter syndrome. I heard about that recently and I can relate to it. Can you make a comment on that? Because you talked about persistent depression being like a gap between who I think I am and who I hope to be. And that reminded me of a description of something I'd never heard of before called imposter syndrome. I wondered if you would like to comment on that or not.
Excuse me, but I couldn't hear. So it is about persistent depression or about what?
Imposter syndrome.
No, it is not a DSM-5 category. It is not in the DSM-5.
Okay.
Yeah.
All right, just curious.
So you can find many descriptions on the internet, okay? But the DSM-5 is a book where the valid diagnoses are listed, okay? And from professional perspective, we can talk only about this, what is written in the DSM-5. So the DSM-5 is like the Bible. It is written in stone, okay? However, every 5 or 6 years, it is changed, it is modernized, and so on and so on. But we have to stick to it from a professional perspective. It is not in the DSM-5, so I cannot talk about it. I'm sorry.
Okay.
Yes.
this might be related to the previous question about the DSM-5, but you mentioned when you are in treatment that there are some exclusions, alcohol being one, I remember, and the other gender disorders. Is that related to being in the DSM-5?
It will be which disorder?
Gender. So first of all, is like under gender disorders, would same-sex attraction also fall under that?
Yes, it is in the DSM-5. However, the professionals are specialized, and the Dominican Counseling Center will be not specialized in dealing with gender issues because they are a touchy topic, but we will focus on other issues like marriage problems, like child-raising problems, like anxiety, depression, like many different existential problems, and so on and so on and so on, but not address those touchy topics like gender dysphoria, for example.
Thank you.
My understanding is that people who suffer from Parkinson's tend to get depressed. Are they suitable for counseling in this case?
You are asking about Parkinson?
Yeah, they say that because of the Parkinson's disease and the medication that they take, they tend to get depression. So are they suitable for counseling in this case?
Yeah. So Parkinson's disease is not a psychiatric disorder, it is a neurological disorder. Okay? So Parkinson's disorder is caused by a hormone deficit, the dopamine deficit in the brain, and by medicine it can be well controlled. The psychological effect of Parkinsonism are secondary, are coming from being slowed down, feeling dizziness, feeling vertigo, feeling not having power, enough muscle power, and the difficulties in coordination. Okay? So the coordination is affected in Parkinsonism because it is called extrapyramidal syndrome. If I'm doing an intentional movement, then the pyramidal system is regulating my movement. But in Parkinsonism, this extrapyramidal system is damaged, which regulates the involuntary, spontaneous, automatic behaviors and reactions. Okay? And this is affected in Parkinsonism mainly, but it is a neurological disorder which cannot be psychologically treated. Only the side effects of it, like feeling sadness because of it, like depressed because of it, and so on, this can be psychologically treated, but not Parkinsonism in itself.
So would it be advisable for them to go for counseling then?
The psychological problems connected to Parkinsonism can be treated psychologically by counseling, but not the disorder itself.
Yeah, that's right, I understand.
Let me say so. If I break my legs, I will be sorry, I will be in pain, I will suffer, and you can treat my suffering psychologically by counseling, but not my broken leg, in short. I don't know whether I answered your question.
Okay. My question is bipolar disorder can also be treated in the Dominican Counseling Center?
Yes, definitely yes.
Okay, and also, what is the difference between major depressive disorder and persistent depressive disorder?
There is a very big difference because the major depressive disorder, it is often connected to bipolar disorder when my brain is not producing enough biochemical mediators. And then there is a center in the brain stem. So my brain has two parts, the cerebrum and the brain stem. Okay. And the brain stem has a center in the diencephalon, which acts like a generator, like a power plant. It is producing energy to the whole brain. Now, if this diencephalon is not producing enough or appropriate energy, then starts the bipolar disorder. So the bipolar disorder is connected to a dysfunction of this diencephalon hypothalamic system, which is not producing sufficient or appropriate energy to the function of the brain. Now I have to tell that depression is not connected to less energy produced in the diencephalon, but to too much sadness produced in the diencephalon. There is the center of emotional feelings. Indeed, I'm simplifying things because many other parts of the brain are participating, but the diencephalon is the main center producing energy. Okay? Now, in the major depression or in bipolar depression, the brain is sick. In the persistent depression, is not the brain sick, it is absolutely normal, but my self-experience is the problem, that I feel a gap between this how I am and how I ought to be. I feel a permanent gap between this what I am doing and what I ought to do. And I cannot bridge this gap. And it is a very painful and self-scrutinizing and self-reflecting condition when I am permanently harassing and judging myself and condemning myself. I am not good enough. Okay? You can hear that my English is not perfect. I can have problems because of it if I have a low self-esteem and say, I'm not good enough, I'm trying to do my best. But simply I cannot. So in every human being exists a gap between this how I am and how I ought to be. Okay? But this is the essence of the Christian attitude, that I accept myself and I'm trying to do the best with the gifts I have. And I'm not making the problem whether my pronunciation is perfect or not, whether I'm making mistakes or not. I don't know whether I clarify the issue. So the major depression in bipolar disorder, then my brain is sick. It is possible to treat it only with medicines. The persistent depression is the medicine will not help too much. Also the medicines help, but the counseling helps, helping the concrete client to understand and to accept him or herself and to appreciate and to do the best with the gifts I have. People with persistent depression are normal, okay? They are healthy. They can work, they can live their life completely healthy. Every human being has a gap between this how I am and how I ought to be. This is the form of human being. If you are interested more, I can talk more about this. Okay, now let me say so.
How do you help someone who has been suffering from depression for many years, and they do not choose to get further help and just rely on antidepressants? And then there are periods in their life, if maybe a situation is a little bit too much, they threaten with wanting to take their lives. How do you approach something like that when you are not knowledgeable with mental health? And how seriously do you accept the multiple times of the threat to take their own life?
Excuse me, I cannot answer personal questions. This is against the professional standards of my profession. However, I will now give a general answer which you can apply to your question. Okay? In 1628, it was a philosopher whose name was Robert Burton, and he first described the symptoms of depression in history. And he introduced a term which is called angst. It is not used today in the medical practice or psychological practice. It is a kind of fear, but a special kind of fear what depressed people sometimes feel. Let me try to explain the problem of angst with an example. I know once I will die. I'm scared of it. But to react to it now, it will be too early. I cannot react now from death, okay, from the threat of death. But when it comes, it will be too late. Then I cannot prevent it anymore. So the angst is a form of feeling where I feel helpless. Whatever I do, I cannot resolve it. It is too early to react now. It will be too late when it comes. So this angst is connected to fear, but it is more connected to uneasiness, to unpleasant expectations, and so on and so on. Depressed people very often have this angst. Now, how to resolve this angst, which is too early to react, or too late to react, or very hard to react? Now, this is where personal closeness helps, where personal warmth, personal relationship helps, which gives a basic security to the patient or to the client or to people. Okay? I don't know whether I explained to something. So, approaching with love, with emotional closeness, this is the essence of treating such kind of depression you were talking about. I cannot give more a personal answer, but I think you understood generally what I wanted to say, okay, or what I can say. Yes.
Hi, doctor.
Excuse me, you will get the microphone in a second.
Hi, doctor. I have a question. Does persistent depression lead to major depression?
Excuse me, I couldn't hear.
Does persistent depression
Yes.
lead to major depression?
No.
No, it doesn't.
No, it has no connection at all.
Oh, okay. Got
So
it.
it is impossible that one has persistent depression and gets major depression. No, there is no connection between them.
Okay. I have another question as well. You said something about when you are policing yourself, that's what causes like anxiety and depression, and to be more forgiving and Christian-like helps you a lot. How about when you are policing or being judgmental towards others?
So, excuse me, what is the end of the question?
Oh, if you are judgmental to others and you try to not do that, will that be also helpful?
I'm sorry, but I cannot understand
Oh.
that.
The question was, when you are judgmental to others, does that have any implications in this situation?
Yes, definitely yes. So, never be judgmental, because you are setting a standard, an expectation to depressed person, independently which kind of depression we are talking about, what he or she cannot fulfill. It is impossible. Like if you would tell me, Dr. Ungar, talk a perfect English. Yes, I'm trying, but I cannot. Okay? This is the experience of the depressed person as well. Yes, I would try to be happy. Yes, I would try to be working hard and be industrious and be active and this and that, but simply I cannot. And this deepens the depression. Okay? So never judge depressed persons because it makes the situation worse.
My question, if addiction leads to depression or depression leads to addiction, I assume that they need to be attacked equally, but could it be that one should be attacked more than the other?
I have to tell you, you are asking so difficult questions that I cannot answer even to myself. So if I would ask a difficult question, I would ask the same. So depression is not connected to addiction directly. However, people heal themselves from depression by, for example, drinking. Okay? Let me try to explain this way. I didn't drink alcohol for a long time, so the alcohol level in my blood is 0.05 promille. If I would have 2 drinks, then the alcohol level would be between 0.5 and 1.5 promille in my blood. And then it would paralyze my central nerve system. It would paralyze my brain. First, it would paralyze the highest brain function, which is conscience. And then I would feel free and laugh and joke and make jokes and whatever and reveal secrets. I would be uncontrolled. I would be happy. I would be acting out. I would feel that I am a Superman. Okay? This is the first level of alcohol intoxication. If I drink more and the blood level, the alcohol level in my blood is increasing, then it is paralyzing the deeper brain functions, and I start to feel dizzy and I'm vomiting and this and that. And the end is paralyzing my center for breathing in the brainstem, and then people go to coma and die. However, this first level of alcohol intoxication gives a very pleasant feeling. And if I heal myself by drinking or even using drugs from a persistent depression, then yes, then it will make addiction. So this is the connection between depression and addictive disorders. Not depression is connected, but the healing, the self-healing of depression is connected very often to problems caused by alcohol and drug use and so on and so on. It was a puzzle for Freud, Sigmund Freud. What happens with people who are not treated? Yes, they suffer. Depressed people who are not treated suffer. And then Freud responded, they will become alcoholics or drug addicts. They will heal themselves by using drugs and so on. So this is the connection.
Thank you.
If you're on the antidepressant medication and it works, I'm not sure yet. I'm not on it long enough, but if you're on it for 2 years, will the depression just go away? Or like if you go off the medication, where are you just going to be back where you were?
So yes, antidepressant medication heal depression, but you cannot stop abruptly, not stop immediately, but gradually. Okay? So gradual stopping is the way of stopping the medication.
I'm in the middle of everything they're talking.
Excuse me?
It doesn't cure depression.
It heals depression. It helps depression. Let me try to illustrate with an analogy. If I break my leg, I use a crutch. The crutch doesn't heal the broken leg, but it helps me to live with it until the leg is recovered. So antidepressive medication has sometimes a similar effect. It helps me to live with my depression And it calms down my self-accusations, my guilt feelings, and helps me to sleep, and so on and so on. This is one effect of it. The second effect of it, if it is a major depression, then the problem is that my brain is not getting enough biochemical mediators. And then I'm getting a biochemical mediator which is missing from my brain, exactly like in diabetes. So in diabetes, the insulin is lacking, and because of this reason I'm sick. If I'm getting insulin, then it is compensating what is missing, and I'm a healthy person. So, no, virtually a healthy person. Now this is happening in depression as well. Okay?
Based on your experience, Dr. Paul, I'm wondering what's the connection between the cause of depression, the gap between who I am and what I ought to be, or the super ego kind of confining a person over, controlling the person to a high degree, and the personal warmth you're talking about as a healing remedy. In your experience, how are those things connected? How does personal warmth and communication become a method of healing for this pathological superego?
Excuse me, but I couldn't quite understand. What is the relation between the superego and...
No, what is the connection between the personal warmth and communication healing remedy you're prescribing
okay.
and the pathological superego?
Okay. Now I will illustrate this with an example. In Europe, I lived in an area where the suicide rate was 60 to 63. Here in Canada is around 20. It was an island of population which was 100 kilometers long and let's say 80 kilometers in width. So in this area, it was an island where the suicide rate was extremely high. Now, people who lived there had a high suicide rate. However, people who come from other areas where the suicide rate was 5 or 10, for example, Albanians, where the suicide rate is very low, when they came to live there, in the second generation, the suicide rate jumped. Now, what is the reason of this? As if something is in the water or air or whatever. We made many researches, we couldn't find out. And then we invited the World Health Organization, and they came. And they came expert for this, and they divided the society in two groups, warm families and cold families. Now the warm families could be good families and bad families. The cold families could be good families and bad families. In good families, people, the spouses were not fighting. In bad families, they were not working and drinking and fighting and so on. Now the suicide rate in warm but bad families was much better than in cold good families. So cold and good families had a higher suicide rate than warm and bad families. So even if the parents were fighting and drinking and whatever and not working and so, the suicide rate among the children was lower if it was a warm family than in a cold family. Now, emotional coldness means being uninterested, being ignorant, not taking care about you, okay? The warmth in the family, despite the family was fighting and having many problems, helped the people to have a basic security against accusations of the strict superego. So the superego is like a policeman, an internal policeman. You are wrong here, you are mistaken there, you'll be punished for that, and so on and so on. The warm family gives a security against it. Okay? The warm family gives a security that despite you are evil, despite you are bad, despite you are unsuccessful, still you are lovable. And it is essential for the people to feel loved, that they feel lovable. So feeling lovable is a significant preventive thing against suicide. I don't know whether I gave you the answer, but if not, please ask me and we can discuss it. Okay.
Dr. Ungar, my question is more on an administrative level, I suppose, if I could use the word, because as a pastor, there's a lot of people that we refer to and to counseling when needed, and because you mentioned about DSM having so many subcategories, like those with marriage problem, with child problem, bipolar disorder, and these are people that we usually do try to refer to counseling. Is there a means on your part, or will there be a means by which we will be provided a working knowledge as to how to decide who to refer to the center, the Dominican Center, so that it doesn't become overwhelmed with clients? Because I can tell you from just me alone, in terms of my interaction with those who are in need, with those kind of needs, there are a lot of people that I have referred to for counseling. So what are the means by which you have in place to try to, in a sense, sort out those who are most in need so that they can get the help that is necessary in this case? Thank you. Yep.
So you pulled my tongue, because the purpose of this presentation was to introduce the Dominican Counseling Center. So the Dominican Counseling Center would have this purpose to, if the person doesn't need counseling, then at least to be assessed and explain what kind of help you need. Okay? So whether you need a social service help or a psychiatrist help or any kind of help, okay? That would be the purpose of the Dominican Counseling Center. So I'm sorry to say, I'm not trying to cut you off, but in short, this is the answer. Yes, the Dominican Counseling Center. I'm propagating our own project.
I just want to ask him a quick question.
I don't know whether I answered your question.
Well, from what you said, it seems to me that you're saying that you would in turn refer those individuals to respective areas.
Yes. At least we would explain the person what kind of help he or she, in our understanding, needs.
Doctor, I just wanted to ask, have you ever dealt in your practice with people that were on medications for depression/anxiety, and then they went and completely went off of them without you knowing? Have you dealt with them afterwards? And do you believe that some people, like in my family, a lot of us are affected with this? I am currently one of those that went and crazily stopped all my meds, and now I'm going through really horrible time, and they're trying to get me off the one I was on before and put me on a new one. Do you believe that some people do have to stay on meds, like it's in our family?
Yes, I cannot give personal advice,
I understand.
but in general,
Yeah.
the medicine is like a crutch,
Yeah.
which you use and need as long as your leg is hurting. If your leg is broken, you use the crutch only as long as you need it. Now, similar is with depressed medication. You use it the longer you need it. Now, in some cases, you need it for a very, very long time. Okay? In other times, you can make it shorter. However, it depends on the effect, how long you will take it. If the depression is gone quickly, you stop the medicine quickly. In other case, if the depression is lasting, you will take the medicine for a longer time. And it can be gradually exchanged one with the other medicine, and slowly, slowly find the best way until it stops.
Hello. I would like to ask a question about how it will be determined or between depression and bipolar, because bipolar can cause depression as well. So how can it be find out what is bipolar and what is only depression? Thank you.
So we told that there are three kinds of depression: the reactive depression, the persistent depression, and the endogenous depression. Okay, both of them can be mild, moderate, and serious. Okay, now the bipolar disorder is, as the name says, bipolar. The manic and the depressed periods are changing. If I'm today depressed, it is probable that in not a short time, but in a year or 2 or 5 or 10 years, I will have another depressive period or a manic or hypomanic period. Okay? And then it is bipolar. It is manic and depressed, or depressed and manic. This is bipolar. Okay? While in other depressions, like in this time, in persistent depression and reactive depression, I am permanently only depressed. I have no manic periods. If the depression and mania are changing, then it is bipolar. Okay? This is the difference. So the problem then is in my brain, which is sometimes making me too depressed and sometimes too manic. The mania have levels. Subdepression is when I am a bit depressed. Clinical depression is when I am very depressed, when I am sick, when I am unable to work. Okay? And the same is with mania. Hypomania is when I am happy and I am permanently in action, but I react appropriately. I can work. I can do everything as every other person, but I am too much active. Well, not too much, but active. Okay? If it goes further and I become irresponsibly selling my things and throwing out during the night my furniture to poor people, okay, behaving irrationally.
You manifest that in your practice, because if you're getting referrals from priests, I would imagine that would be important.
Yeah, I congratulate you. You are asking very good question. Okay? So yes, you are absolutely right. Okay? That replacing the strict and unforgiving, realistic but strict and unforgiving superego with a Christian conscience should help you to do two things: to love your God with all your heart and soul and commitment, and to love your neighbor as yourself. Superego doesn't help this. No. We are in a fight for survival, where the most adapted will survive. This is the superego's condition. So the superego is useful in everyday fight for survival of the fittest. My Christian conscience is very different, loving, forgiving, easygoing, and so on. Okay? So yes, the difference between the believer and the non-believer is essentially also in conscience. The one has a superego, the other one has a Christian conscience. However, did Jesus Christ have a superego? Yes, he had. Yes, he survived. His superego helped him to protect his life. So every human being has also a superego and also a Christian conscience. But there is a hierarchy between them. They are not equally commanding or directing my behavior. I'm trying to be unselfish and loving and so on and so on. Okay, I'm trying to adhere to my Christian conscience and not to my superego. Okay, but superego is also, I cannot live without it. Okay, it is a part of my biological being. As one theologian defined, we are a new creation in which worldliness and holiness are connected. So worldliness, living in the world, is connected to holiness, to being quite other than the world, being not attached to the world. Okay? As John 11:17 or 17:1 wrote, we are in the world but not of it. Okay? But we have to be also in the world, but not of it. Okay? I don't know whether I answered your question. Okay. Are there any more questions or? What does it mean?
So I think according to Kathy, we've got all the questions.
Yes.
So again, I would want to thank all of you for choosing to spend the evening with us, and for Dr. Paul for his excellent presentation and willingness to answer all of our easy and not easy questions. So we would invite you, we will continue to have these forums on different topics in the months ahead, and we would invite you to keep an eye out for the events that are happening. Again, we will post the slides for those who are interested, and the talk will be available for those who would like to watch it again or share it with others. So thank you, and have a lovely evening.
Thank you.